The vaccine approval process for kids 5 to 11 years old is no different than the process for adult vaccines or booster shots. This is a graphic from the Oregon Health Authority showing the process. At this point, the FDA has given the Pfizer vaccine a green light for 5 to 11-year-olds. Next, a CDC committee will have to evaluate it, make a recommendation. The CDC's director signs off. Then it goes to a group made up of a handful of Western states. The last hurdle, the governor approves it. All that is expected to happen this week, so it's really no surprise that many parents have been watching the process closely.
I will feel a big sense of relief when he gets a vaccine so that we can, move on from this a little bit.
Courtney Westling is talking about her 6-year-old son, Evan, who is already scheduled to get his first dose next week if all goes smoothly.
I still have a 4-year-old, so he's not eligible yet. But I do feel like the vaccine wall around him will keep him pretty healthy.
Westling also happens to work at Portland Public Schools. She's in charge of rolling out a pilot program aimed at vaccinating kids 5 to 11 at 8 schools, of course, with parent consent.
We have a pilot program we're working on with Kaiser Permanente and Medical Teams International to offer 8 sites in Portland, specifically focused on schools that have very high barriers to accessing vaccines.
She says the schools have many historically underserved students.
We are centering racial equity and social justice in all of our work, including how we allow for vaccine opportunities in schools.
Westling says the first clinic will be running as soon as next week.
I think we'll have 6 clinics before Thanksgiving.
She says it's possible a couple of the schools in the pilot program will have clinics into the beginning of January. After assessing the pilot vaccine clinics, the plan is to add more vaccination opportunities for kids 5 to 11 years old. Meantime, the Oregon Health Authority has also been preparing. A spokesperson says the state has ordered nearly 120,000 doses for kids that are expected to go to 300 sites. Christine Pitawanich, KGW News.